Hello and welcome to a new edition of Gerety Talks. Today we are having the third episode on our talk on health and pharma advertising, and we have three special guests that are experts on the matter. Chessa Williams, Senior Creative Director at OpenX Health. Rob Fuller, Head of Planning at VCCP Health. And Tash Beecher, Creative Director at Synethesis Health. Welcome. And thanks for joining us today. So please let's start by introducing ourselves and tell us a little bit more about your roles and agencies. Chessa, would you like to start?
Sure. I'm Chessa. I'm Senior Creative Director at OpenX Health. I have like an art and design background, so very much pictures, not words, but all about the big idea, all about creativity. OpenX is the kind of strapline about it is all about data-driven creativity. So yes, it's creative, but it's always powered by data. We're testing things, we're always making sure things are evolving and making sure that the campaigns keep resonating throughout their life. Yeah, that's me.
Rob, would you like to carry on?
Yeah, sure. So hi everyone, I'm Rob. I run strategy and planning at VCCP Health. VCCP is the challenger agency for challenger brands. So we specialize with working with brands that are facing kind of really big or small, gnarly bears in the world. So our logo is this young lady standing up to this enormous bear. And that's what we love to do. And that's what I've always loved to do from a strat point of view. When I finally found my way into agency life and into strategy as a discipline, all about seeking out those really gnarly kind of human challenges that stand in the way of our clients and our brands and people around the world living longer, healthier lives, and figuring out smart, creative ways of tackling them. So yeah. That is me.
Tash?
And yes.
Last and definitely not least, Tash. Go on.
I'm Tash Beecher. My pronouns are she, her, and I'm a copy-flavored creative director for Synethesis Health. And Synethesis Health is basically a bit of a anomaly, I think, within the kind of health and pharma space. So it's actually like a fully integrated biopharmaceutical solutions organization, and within that we kind of go from lab to life, right? And so within that entire unique platform, we have a creative agency, and that's the bit that I work in. So we do anything from kind of advertising communications to PR to medical communications as well, and our creative department spans everything. So anything that you can think of, and we kind of assist customers to accelerate their own success.
Great. So let's start with a very easy question. What do you think are today the biggest challenges the health and pharma advertising industry faces? Who has the courage to start?
Easy question. Nice.
Yes.
Massive question.
Massive.
Who wants to go first?
I mean, I don't mind. I think that with all challenges come lots of opportunities, right? And I think in our industry, we've always had the challenge of the kind of regulatory boundaries. That's kind of, the first thing that I think of. But that's always been an opportunity, right? And I think it's always been an opportunity to be more creative, to kind of push more of the boundaries. And I always think you could have a great idea for a consumer brand, and the real litmus test is if we can get it to work or pivot that idea to work within our industry, then that idea is good enough. If it's not, then if it doesn't work, then obviously you need a better idea. So I think that is one of the biggest challenges, but also AI. I think AI is
also AI.
But also AI. Discuss.
Can we part the AI one? Go on.
Yeah, I've got a lot of feelings about AI. I think we're going to talk about it a bit later as well. There's some things coming up with AI later down the line. But yeah. Oh no, I'm a big fan. You have to be. You've got to get on board, otherwise it's just going to pass you by and you're missing out on a whole bunch of things. But we need to use it as a good thing, not a blocker.
Yeah, I think we're quite well equipped in our industry, to be honest, because we're kind of used to the boundaries. Like I was saying before, it's the kind of regulatory frameworks that we're used to navigating. I think that is one of the things that allows us to be able to address the challenge of AI, and it's an opportunity as well.
As someone who started, believe it or not, like the very first job I had working in healthcare was working in a regulatory and a medical role. I don't even know how the hell I ended up running strat in a creative agency for a living. Still baffles people I worked with back then. Although they always used to say, you're a bit too creative for this, Rob. I think you should try like marketing or something else. Anyway, here we are. But yeah, I think it's interesting. I totally agree with what you're saying, Tash. Like that sense of like a beautiful constraint, and actually if you can make your brief, if you can make your idea work within the sort of the within the letter of the law, or at the very least the spirit of it, then yeah, I think that's kind of what I like, kind of keeps me coming back and keeps me pushing hard. And you know, the best ideas I've ever made had the legal team as their biggest champions, and those are the ones that kind of always stick with me. Is like, how close to the boundary could we get and still be relevant and still be meaningful and still have an impact? And that's yeah, it keeps a lot of people coming back. I think actually keeps us going.
Yeah, definitely. Gosh, I mean, back on challenges. I mean, I found this question quite tricky actually, because I was thinking about it. But I think this challenge has been the same probably for like the past 10, 20, 30, however many years. And it's the same in non-pharma advertising. It's just about capturing attention. That's the main challenge we've got. And I think what's harder about that now is that, I mean, it's truer than ever because there's so much stuff. We're being shoved stuff all the time. Like people are being thrown things left, right, and centre. So we're trying to cut through the noise. And especially now there's even more pharma agencies coming in. People are making stuff all the time. So the challenge is to just cut through the noise, make good stuff that sticks.
Yeah, I think that makes sense. I think I was sort of there's another angle here. I think another challenge I was thinking of. It's a little bit more like inward looking for our sort of industry. You know, we're all sort of agency folks, right? And I do think that perennial challenge of representation within our industry at all levels, I think, is something that it's not just a health agency thing, right? It's an ad creative industry wide thing. And there's lots and lots of great work that's always sort of continually seems to be ongoing in that area, but it never seems to be a problem or a challenge that ever goes away completely. And I think healthcare agencies, you know, because of the skill sets that we need to do the work that we do, are quite, in some ways they're analogous, right? And people can make that transition from consumer to B2B to health, whatever. But in some other ways, we have really we need quite unique skill sets sometimes, and that I think brings its own sort of representation sort of challenges. It's a big topic, but I think that's something that I know at VCCP we're very sort of focused on and passionate about, and I'm absolutely sure it's the same at Open and Synethesis, right?
Yeah, you have to be. You just do. You have to be human and try to resonate with as many people as you can, and making sure you're not kicking people out without realizing.
Yeah, exactly.
Yeah, and I think, you know, you one of the ways that you solve that is to be looking in different places. And I think that in our industry particularly, we are potentially used to looking only in one place, in one pool of people, because like you said, like, there's a really specific set of skills that we're looking for on one hand, and so we kind of over-index for those particular skills in, you know, tried and tested areas, whereas actually, like, we can be a bit more adventurous. And yes, there are these things, but have you looked over here actually, because there's loads of people that have those skills and then some, you know. So I think that's always a challenge, like you say.
Yeah, we layer on filters sometimes without realizing it, right? We don't just need a writer. I need a writer with a PhD in this very specific therapy area who went to this very particular university. Like, yeah. Do you really? like, and asking good questions of ourselves and our colleagues internally becomes like an even more important thing, because I'm sure that, like, you know, none of us have probably had particularly linear or traditional routes to get anywhere. There's no such thing. I have that conversation with people all the time. I ask, what's the best way to get into it? Well, like, you know, ask anyone who's made a living in this area, and you'll have ask 1,000 people, you'll have 10,000 different stories. So
yeah, the common theme is they didn't know it existed, they fell into it, and then they never left.
Yeah, and they still don't know what they're doing, but they're doing it every day, right? Like, yeah.
Okay, so I know you're craving to speak about AI. Let's just go directly to the theme. So what are your feelings? Do you use it? Do you think it's going to be good? Or what is your opinion on it? How has it changed also your work or your way of working, which is interesting?
I mean, I've definitely noticed loads more use of AI. Like, it's been really helpful from a kind of visual standpoint. You can quickly plug something into Midjourney or something for a proof of concept. You're not going to get your final piece from it, but it saves you hours from trying to scroll through Shutterstock, finding the perfect stock photos that you need to comp together. I mean, it saves you loads of time there just for a proof of concept point of view. And I think the way that I've noticed it being used really well is like as a starting point. You're never going to get anything good. You're not going to get the finished product from it, but think about it as like a block of marble to start with, and then you keep chipping away at it until you can get something great at the end of it. So it's definitely useful. I do feel like we have to get on board with it, because we don't want to get left behind. We're always going to have new tech. There's always going to be new things coming our way. And in healthcare, we can be a bit slower on the uptake with these kind of things.
For sure.
So,
For sure.
yeah, I do really think we need to just kind of get on board.
Get on with it. Yeah. One of the things that's, again, industry specific to health and pharma is that I think it's because AI is such a fast moving, evolving gray area. We're more used to stretching almost predefined boundaries rather than making them up as we go along. And so, like, I know that at Syneos we've kind of baked AI into everything that we do. Like, we had literally yesterday, we had a hackathon where everybody in the creative department had been set this task, and it was so interesting to see the different programs that everybody had used to solve the brief, and the criteria is that you have to use AI like as much as possible. So that was kind of the opposite of what maybe they had been used to exploring. So that was really cool. But I think going back to what you were talking on before, Rob, about talent, I think the way that we kind of get more on board as an industry is to continue to bring in talent who are more entrepreneurial, the tinkerers, the experimenters, the playful ones, like some of the outside of what we would usually look to, like, get more of those, because I think that's the only way that we can stay ahead even of the AI curve, if that's even at all possible.
No, I completely agree with you. I think if we're in, like, even in a year's time, 2 years time, if we're still only using AI to get to key visuals quicker, then we've kind of missed the point, right? Like, it's much more, it needs to become and should become much more sort of fundamental to that. I think, look, I guess I'm the odd one out here, right? In terms of I'm the planner, right? So from my point, from a point of view of a strategist's craft, I think AI has become incredibly useful as that sort of pseudo sounding board and source of sanity and inspiration in kind of equal measure. But I think I read a piece from an old colleague of mine the other day who sort of described how AI's has helped planners turn them more from thinkers into thinkers and doers. So whereas it used to be, I would rely exclusively on my art director or studio, whatever, for like visual inspiration, and exclusively on my copywriter to take my kind of linguistic fumblings and turn them into something actually moving. Now I don't need to, right? Facetiously, I could just do it myself, and I can go to the creative department with an idea, right? And then you can just make that. But I do think it allows us to poke around a little bit more and get creative ourselves. Strategy's always, I think, been a creative discipline in the way that I've looked at it. We just don't get to have the last idea. We're supposed to have the first one, but we don't get to have the last one. But I think AI is helping us with sort of putting a little bit of action alongside the thinking.
It just gets the ball rolling quicker, doesn't it?
Yeah.
It gives you a place to start, a place to kick things around from, and then you can move into those conversations just that bit faster.
For sure.
But it will never replace the good thinking that we do, but we need to use it as a tool, I think.
Yeah,
we do. Have you? I don't know how if either of you have sort of found with how are your clients feeling about it? Because I think that's also the acid test. Like, there are so many things that creative agencies can hook onto and take to clients as like this really exciting next big sort of thing, and clients, some of them would be like, awesome, let's go make something. Others would be like, where's my leaf piece? So yeah, I don't know how you finding like your clients are kind of reacting to it.
I think we are definitely seeing clients, or some of our clients, we've kind of empowered them to be ahead of where we are. So we've kind of been going out and really encouraging them to make use of it. And now they are asking for it. Like the ones that I value the most as a creative are the ones that are kind of coming back to us and challenging us to, say, how are you using AI? Like what is your process? Do you have a process yet? What's your kind of development discovery method, Yeah, I mean, Chessa, I don't know about you.
I mean, I think yes. I mean, to what both of you are saying, like there are some people who love it, some clients who are like, yes, what can we do? How can we make things more efficient, quicker, cheaper? But then also there are the ones that are just really hesitant because they've not done it. They don't really know the process. They don't really understand what they can quite get from it. So there's a education piece there that we need to kind of still go and do. But yeah, so it is kind of a bit of a mixed bag, really.
It's that unfamiliar play, isn't it? I think
that's it. I
think everybody, all of us, I think, are used to, again, where those boundaries are. And the thing is, with AI, there's not always a definitive answer. We're not in a place right now where it's, we can assign a timeline to how long something might take when we use AI. Like we're exploring that, and our clients, to be on board with it and to be excited by it need to also be a bit playful and accept there is a creativity, playfulness, which is really fun and excites me a lot.
No, I think it's going to be really, really interesting to see where it goes, because farmers always, like, in some respects, farmers like ahead of the curve on AI. It's just probably the bits that we don't see, right? Like, so in terms of like drug discovery and things like that, there are people sitting in these organizations who are probably amongst the top thinkers in the world on AI. It's just they don't ever come near the communications, the brand, the advertising side of it. So I think it will be interesting to see if pharma companies sort of switch on to that and start to deploy some of the expertise they've already got inherently in ways that might come slightly closer to the world that we inhabit. Yeah.
And the pandemic brought changes to everything in our lives. Of course, I can imagine your industry was very much impacted by it. What do you think are the biggest or most significant changes?
I mean, there's been pros and cons, I think. I mean, there's a whole new area of focus that exists now. Everyone wants to do something to do with COVID. So like whether it's educating HCPs or the public, everyone has an interest in COVID because it affected everybody. But then that's kind of the positive, the one positive I can think of. But then there's the hybrid working thing that, I mean, I'm sure everyone's doing. Not everyone's in the office anymore every day, like maybe just a couple of times a week. I'm at home right now. And like, everyone knows all the pros and cons. They've seen a million LinkedIn articles about it, I'm sure. But I think the biggest issue I found with working from home is trying to support and mentor new talent coming up. I can't imagine how difficult it must be as a junior creative, trying to learn everything and absorb everything when it's just them and their screen. So, when you've back in the office days, you could just kind of look over someone's shoulder, ask them what they're doing. And now you have to make that conscious effort calling people. You just have to try that bit harder to engage people. That's definitely the biggest challenge I've noticed, but I don't know about you guys.
Yeah, I agree. I think that, there's something to be said for like juniors and the kind of physical shadowing of mentors and managers, and it taking them longer to like learn how to do the job. But it's almost, the tech isn't quite up to it. I think like it would be great, I think it's great that over the pandemic people have almost discovered the way that they work best, and controlling their own working environment. That's kind of great. But at the same time, now that we're over that part of the world's history a little bit, that random spark isn't, how do we get that random conversation, the chats over the desk, the tapping someone on the shoulder, that's the tech isn't up to scratch basically. And it's frustrating, because if it was, it'd be easier.
It puts a time limit on things, don't it? It's like, well, we'll collaborate at 2:00, and you can't, ideas don't really come like that. It's not how it works.
Yeah, it gets a bit more like, the risk is it gets much more transactional, right? As you say, like, your day is measured in like calendar blocks, not in ideas and conversations, which is why, I moved roles recently in the last couple of years from a company that had no quota to a company that would like everyone in at least sort of 2 or 3 days a week. And I have to say that I find the latter situation personally, it's not for everybody, but like personally, I found that the quality of my creative thinking went up, getting back in more frequently, and having that slight more sense of structure, I think is interesting. And I think that the same thing that you're both saying is also true. I don't know if I found it with clients as well. I think one of the downsides that I've experienced, one of the changes is the decrease in actually getting cheek by jowl around desk with a client and thrashing something out. It's exactly the same whether we're in the office, doing our day jobs, or whether we're with our clients, kind of, figuring something out together. Certainly traveling a lot less is clearly better for work-life balance and for the planet. And I kind of totally get that perspective. But God, sometimes, a lot of heartache could be solved by getting around a table with a client and a blank piece of paper and not leaving till you figured it out. And that, you have to Chessa's point, you have to now force the structure into that. And that removes the humanity from it a little bit. So I think that's we're there yet, but yeah.
I think because we had like a face-to-face with a client the other day, and it had been ages, actually, like quite a few months since I'd done that, and it was magic, just being able to have that conversation and really get what they were thinking in a way that you can, read body language there in person. Like this is unequaled. And at the end of it was kind of like, we'll do this again. And you could see the light bulbs, like people had forgotten that you can do this, and you don't have to do it all online. Like, people forget it. And one thing that I wanted to kind of pick up on the kind of remote working thing is that I think we're definitely in a place where I think some businesses are flailing a little bit, because obviously people were given the autonomy and the trust to kind of figure out what works best for them, and to your point, Rob, like now this kind of mandated flexible working, I think we still have to navigate what's best for individual businesses to that end as well, because it's I think we can't forget that trust to over communicate with each other needs to still be there. I think it's fine to have the mandate, but let's not lose that trust, I guess.
Yeah, I completely agree with you. You can't set a day on things. There's also certain things where you just need to get your head down. If you're in the office, you just have people bothering you all day, then you never get anything done. But then, those times when you are all together, make the most of it. Like, go out and do a thing and just be with each other.
Yeah. That sort of help. I think a lot of people realize the value in like serendipity and synchronicity. Like, I don't think we necessarily appreciated that explicitly pre-pandemic in the way that we now do. When you have the opportunity for something unexpected to happen, somehow suddenly removed, because unexpected things don't happen if you can't leave your house. When you suddenly remove that, you sort of come to the world afterwards and you're like, oh God, yeah, actually the best thoughts do happen, when I, took the different path to work, or I, did the different, had lunch with those bunch of people I randomly bumped into in the elevator, right? Like that's the shit that like I think, we took for granted, pre-2020. And I think now realizing that you can design for it, to your point, Tash and Chessa, like you can design for it to an extent, but you also have to empower people to find it for themselves. And I think it's an interesting one for us to see where it goes, right? Because some industries are getting everyone back in full-time come hell or high water, right? And it'll be interesting to see how they fare in the long term. My hunch is not so well, but we'll see.
Spontaneity is lost a lot in what you were saying, Rob. Spontaneous things happening, just like they don't happen over Zoom.
They don't happen over Zoom.
It's not the same.
Precisely 2:05 on a Thursday afternoon, right?
Well, this is it. I was gonna say, I heard that as a challenge. I'm thinking, actually, like maybe we should like force this like unexpected things that can happen when you don't leave your house. Like, I wonder how long it would take, how far you could get creatively to to some kind of fun narrative. Anyway, it's a digression.
There's an idea in that.
Or cabin fever. I don't
know.
And let's see how humor gets into the equation. There's a big craving for humor in advertising, especially after the pandemic. And laughter has been shown to provide a myriad of health benefits. And yet, when it comes to healthier marketing, we tend to take things very seriously, though it's true, brands need to approach comedy with caution. What do you think is the relationship between humor and advertising in the healthcare sector in particular, and how do you think it can be used efficiently?
It's a really tough question, that, isn't it? I think I'm all for appropriate amounts of levity. I think that, like you say, we've needed that. I think different awards that I've kind of judged over the last few years have shown that there is an appropriate amount of levity. And I think the relationship between humor and the work that we do is the humanity. Like, it's one of the things that keeps us human, is being able to not take ourselves so seriously all the time, and just injecting a little bit of human nature into the work that we do, I think goes a long, long way.
Absolutely. You've just, as long as it's not kind of completely tone deaf, I mean, I'm all for it. Especially you're talking to people at the end of the day, and if that's what connects you to them, then tell a dodgy joke. I don't know. I think it's been really, really great especially when it comes to things like internal training, trying to get people on board, trying to get them to learn something. Sorry, it helps people remember things that bit better. And also, where I found it's worked really well are things aimed at patients. Again, in a sensitive sort of way. I found that when you're talking to patients that are going through something, they know the humor in their disease, they know the things that are funny that are happening to them. So it can almost be tone deaf to ignore that sometimes and try to do everything to tiptoe around them. Just, be real with them.
Yeah.
So
I think I very much agree with what you're both saying. I think it shows up right now. It's showing up way more in like patient or public facing kind of work. I think that's quite kind of interesting to look at. But I think if you take sort of maybe not RX particularly, I'm not sure it's showing up. And I'd need to think a little bit more about how it might show up in like brand. I want you to prescribe this incredibly innovative oncology treatment, doctor. Here's a one-liner. Did you hear the one about? I'm not sure how that plays, but I think it's interesting if you look at like the consumer health space, though. I was doing some work recently thinking about like, in some places humor's this like category cliche that actually has to be where it doesn't help. Actually, it's kind of hindering, right? Like we sometimes laugh at like we over the years thinking about like gastro gastro treatments and things like that, where we've kind of, if you take, you know, a huge selection of like consumer health kind of brands that have worked in sort of gastro or something similar over the years, and there's all sorts of terrible funny cliches and bad puns and stuff, and it kind of like becomes a bit of an excuse not to talk about something more serious. So I think, yeah, there's definitely a huge role for it, and it's probably something that we could all be using a little bit more. But there are also spaces within healthcare where it's become almost so done that like it's actually becoming more damaging in some spaces. And to your point, just like it's about that, finding that appropriate line through the middle of it all. And then getting clients on board with that. I don't know how you guys, you know, kind of the clients that you folks are working with, but like, you know, we work with clients all over the world, right? And what makes someone laugh in Switzerland does not necessarily ring true in London and vice versa. So I think there's also kind of finding the universalness in the humanity and what's universally funny is powerful. What's culturally subjective, I think, is also becomes a little bit of something to navigate. Yeah, it's interesting. There's some stories behind that I probably don't time to go into on this call, but
oh yeah, later.
We've been there. We've all been there.
And a last question to wrap up is, what would be your advice today for someone who wants to get into the health and pharma advertising industry?
I love this. My advice is just do it. Do it. If you want to do it, just do it. Keep up with all the good work that's being done out there and the bad work, so you know what not to do in health pharma, but also consumer as well. Just see what's out there. Be inspired by things. It's so rewarding to be in this industry. I mean, I went to art school. I never thought I could help people in any sort of way, and then falling into this weird sector, there's finding myself being able to make an impact on people and helping them with their kind of health, wellness. It's incredible. It's just such an incredible thing. So just do it.
Yeah. I have a slightly different, I agree with you, Chessa, I do. But I will say, I have this conversation a lot with like, especially with more, you know, I do a fair bit of mentoring people who want to get into this industry. And I've worked with a lot of people who have come from other industries. And often the narrative I hear is, you know, I want to do something more purposeful. I want to do something more with meaning. I don't want to, you know, I'd rather save lives than sell beans, like that kind of thing. And that is really true. But the thing I always kind of just caveat it with for people I'm speaking with is that, like, yeah, but our clients are not like, they're not altruists, you know, they're not. Oh yeah, they are still ultimately trying to sort of, you know, hit a profit and loss margin and everything else. So like there's a balance sheet involved. It just doesn't feel quite the same as maybe an FMCG space. So I think there's always like, yeah, embrace, immerse, and it should feel good. We should feel good about what we're doing, because you know the clients that we work with and the medicines that they bring to market are, you know, saving and changing, you know, millions of lives every day. But there is a sort of an underlying commercial reality that, like, maybe it's the strategist in me, right? Like you have to, I think, have an understanding of how our clients' businesses work, right?
That's advertising, though, right?
Still advertising, and we're doing it. We're just doing it with a slightly different lens and a slightly different sort of point of view. So I think that find that balance with it, but then go for it, right? And so just because it can feel like a weird world doesn't mean it can't be actually quite magical once you get into it. It's why I think, I don't know about you guys, once people find their way into this space, they don't tend to want to go anywhere else.
They're in it forever.
Far more people want to come in than say, I'm bored of working on pharma, I want to go and sell vodka. That's not a story I've heard very often, and I think the world's probably better for it.
I agree with everything that you've both kind of highlighted, and I would add that remember that, you know, creativity is built out of life fodder, right? That's kind of my thought, and so the translation of that is that just continue to have experiences and human experiences, because that all translates into what you can do within our industry. You can help people and you know, be a conscientious salesperson, because at the end of the day, we're not artists, are we? We are salespeople, and we use that, our creativity and the way that we look at the world and interact with the world, to sell things to people. And yeah, like everyone else has said, go for it. Like, remember that, go for it, and do as much listening as you do talking as well.
That's a good one.
I love that.
Two ears, one mouth.
That life fodder point is so true, right? There's nothing more satisfying than hearing someone go, oh, do you know what this reminds me of? And then like they reference something, could be anything, right? It could be something on another brand, right? But it could even better when it's something weird and wonderful that they read in a book 3.5 years ago, or like, you know, someone's gran told them at a family party kind of when they were 4. Like, you know, it that's the stuff. Like, life fodder is a great expression. I'm
not trademarked it yet, so don't jump.
All right, okay, that was going to ask, is there some sort of IP on that? Because if there isn't, you need to nail that down pretty quick. That's pretty cool. Like that.
Writer.
Thank you so much for sharing your opinions, views, and thoughts with us during this moment, and best of luck with all the projects you carry on in the future.
Thank you so much, and thanks for having us.
Yeah, thank you. It's been a blast.
Yeah, I've loved it.
Thank you.